HHS Secretary Robert F. Kennedy Jr. has spent much of his career trying to eliminate autism, which he falsely links to vaccines and now Tylenol. Yet President Trump and Congress just signed off on $1 trillion in healthcare cuts, which will eliminate or diminish services, critical services, for people with autism. I'm Dr. Vin Gupta, a public health physician and pulmonologist who you may recognize from my role as a medical analyst on cable TV. I'm teaming up with COURIER to go beyond the headlines and statistics to talk to real Americans whose lives have been turned upside down by our broken healthcare system. This summer, President Trump signed into law a bill that strips $1 trillion of healthcare funding from Americans in order to give more tax cuts to the wealthy. One provision in the bill includes stripping federal funding from Medicaid, our nation's health insurance for those most in need. Ari Ne'eman, an assistant professor of healthcare policy at the Harvard T.H. School of Public Health, who is also autistic, says that the Medicaid cuts will be profound for a wide range of people with intellectual and developmental disabilities, especially as more people receive a diagnosis.
Secretary Kennedy frames his autism agenda as focusing on autistic people with the most severe impairment. It is true that we need more of a focus on people with the most severe impairment. But, there is no universe in which you can improve the material circumstances of people with intense support needs and also implement a $1 trillion cut to Medicaid. Medicaid is the foundation for services to people with the most severe needs.
Why specifically are autism rates rising across the United States?
Changing diagnostic practices. People who would have received a different diagnosis, or in some cases no diagnosis in prior generations, receive an autism diagnosis today, in part because we have broader diagnostic criteria, in part because there's been a shift away from other diagnoses like learning disability or intellectual disability into autism.
If you're a person with an intellectual or developmental disability, or if you're a parent of somebody that might be having a relevant disability, I'm curious, can you find supplemental coverage for Medicaid-funded home and community-based services? Is that a possibility?
No, there's no equivalent to this in the commercial market. For people with intellectual and developmental disabilities, it's common for home and community-based services to cost tens of thousands of dollars a year, and for those needs to continue over the course of a lifetime. This isn't like traditional medical care where it's expensive, but you only use it one time. It's an ongoing form of assistance. Medicaid is really the only payer for these services.
What happens then if an autistic patient doesn't have this support? Where do they go?
Without home and community-based services, some people will end up in institutions or nursing homes. And that's a horrible way to live. We really have put in decades of effort in bringing people out of institutions and nursing homes and into the community. It's an environment in which people lack basic autonomy. They lack inclusion in the broader community. They're separated from their families. It really is a terrible outcome. Other people will remain in their family home, and what'll happen is their family members will have to quit their jobs in order to provide uncompensated care. And I think we're going to see a lot more of that.
That includes people like Joshua, a 28-year-old with autism. Joshua's mom, Judy, says that he's 100% reliant on Medicaid for his healthcare and daily living.
Judy, so I understand your son Joshua relies on home and community-based services. Can you tell us a little bit about his living situation?
He is a wonderful young man. He has a lot of support needs. So he needs help from getting up in the morning to showering and toileting and all those kinds of things he needs support with. He also goes out in the community every day. He goes to various restaurants in the community where they all know his name. It's kind of like Cheers, where they say, "Hey, Josh," as he walks in the door. He has a small job that he works at a t-shirt printing company where they employ people with intellectual and developmental disabilities. And he takes an exercise class, and he is out and about every single day and just loves being in the community.
Our nation is facing $1 trillion in healthcare funding cuts. If his services go away, how will that impact Joshua's daily life?
It's going to be devastating. There are many families, in fact, most families I know, who don't have the luxury to be able to say, okay, I'm going to quit my job and I'm going to help my child all day long.
Joshua's care is paid for through a self-determination budget, meaning he is able to use significant resources to pay for aids and other supports to help him live on his own.
But they can only do as much as funding that they have. And if they're going to lose billions of dollars in federal Medicaid funding, they are going to have to cut because it relies on federal funding.
People with autism and other intellectual and developmental disabilities should have the right to live on their own in their communities. Provisions in H.R. 1 strip that dignity from Americans, sending ripple effects through our nation.